Thank you all so much for submitting these. I'm going to package 3 of these questions together because they're related but represent a spectrum. So we have one parent who says, I had to force my child here tonight because I think they need help. They're resistant to being labeled as a mentally sick child. So no diagnosis, but parent realizes they need help. Another child who actually has diagnoses of bipolar, depression, anxiety, but doesn't want to admit that he needs help. And then a third child who seems bipolar, is probably using drugs, refusing counseling. Police have been to the house several times and recently arrested for physically threatening family members and is about to turn 18. So you have a whole spectrum of issues here that I think you all might be able to help with. What do you do in each of those situations?
I think the last one is actually the easiest, because if you've got the legal system involved, you can then sometimes actually get legally mandated treatment. And then that about to turn 18-year-old, you can refuse to drop the legally mandated treatment even after they turn 18, so you can get them as part of probation or probation before verdict. Court-mandated services where at least they're supposed to show up and get some help. If they do okay and they turn 18 and then they stop, it's a little bit harder, but sometimes having that external agency actually is a way to get some help, even though it's not pleasant. Then you can sort of, as the parent, you'd be off the hook and say, I'm sorry, this is what the judge is saying. And I've certainly had people that I've taken care of where we've tried the standard therapy, school intervention and everything, and that doesn't work because the kid's smart and they're sneaky. And sometimes then we get to the point where the legal system is involved, and then things actually turn around sometimes.
Are there things that the parent should say to the judge to make to trigger that?
That's probably more for the lawyers, but I would just, because lawyers are helpful and there's a lot of them around here, but I think what you can say is, I think my child's very smart and they're gonna lie and they're gonna get out of this and they're not committed to treatment, and I need your help because I'm worried about my kid. And the family court judges will listen to you when the grown-up court judges won't, because their goal is helping families, actually. And sometimes they like to be strict and set a rule, and you can work with that.
How about the 2 kids, one has a diagnosis, one doesn't, both seemingly need help, but are resistant to being labeled as mentally ill or seeking help?
It's somebody else's turn to answer. I'll just keep talking. I mean, you work with parents all the time.
I was going to say, I mean, some of this is how we shape it and frame it as parents. I mean, of course, you know, our kids are going to be resistant, and there are times, I think, as you said beautifully, when, you know, we have to know that there's going to be some fire coming our way, and that, you know, that's just part of it. But I do think that, you know, if we can try and normalize it for our kids, you know, if we can just be sort of matter of fact and check our own emotions, because we're modeling a lot and our kids are feeling and feeding a lot from us. And so, you know, the more we can kind of adjust our, you know, I think first the more we can look at our own true feelings about it. It's okay for us to have our own biases and stigmas, but we have to be honest about it. And we have to look at those and acknowledge them, because we are communicating them. So if we can figure out kind of where we're coming from and try and get ourselves to a place where we feel, you know, that this is our, you know, it's a health condition and it needs to be treated just as we would treat, you know, many other, you know, diabetes, or, you know, we'd get glasses if they couldn't see as well. You know, we need to change, you know, the frame of reference for some of these issues.
And I think the other thing is, it doesn't mean having a mental health care illness just means it's in your brain instead of your lungs or whatever, but it doesn't mean you're crazy. I think so often there's a lot of stigma around mental illness. We haven't spent a lot of time talking about it, but that can be school-based, that can be family-based, that can be belief-based. And I had a kid in my office the other week, and one of the Fairfax County high schools was having Mental Health Awareness Week, and it was, of course, one of my patients, so they already had a mental health care issue. And the negative, nasty comments coming from the classmates made my patient very upset, and the teacher didn't do anything about it. And that's where I think the new program that you have of helping Fairfax County schools with the parents, it takes that level of, I'm not going to tolerate this garbage, because nobody'd make fun of the kid with cancer. That would be unacceptable. If it was Cancer Awareness Week, nobody would say, oh, there's the kid with no hair, and he has cancer, and he looks weird, and all the rest of it. That's unacceptable behavior, but they can make fun of somebody who is emo or emotionally unstable, and that's not okay. And our schools shouldn't be tolerating that. We've got an epidemic of suicide in Fairfax County high schools. It should be their top priority. It's the third leading cause of death in people under the age of 20. After accidents and other bad stuff. It beats out cancer, beats out deaths from asthma, beats out cystic fibrosis. It's one of our top killers, and we're not talking about it and dealing with it in a responsible fashion.
I would just say that this, the stigma is very real, and dealing with a child who is diagnosed at such a young age, she's constantly struggling with how much can she tell her friends, and how much does she want us to share with family members, church members, and friends. But the thing that I found is that as we began to open up and talk more to our neighbors and to our church family and to those in the school system, it made it easier for some reason, because people, not only like what Chris said, they have someone that they've been close to that also has a diagnosis, and then they come and open up to me. But it sort of explains the behavior a little bit, and then that helps me be able to ask for support. I don't know, some of you may have seen it. We were, she and I were on an NBC4, one of their Changing Minds things last week, and she was a little bit upset about the way that they portrayed her, because they put like a police flash across her face when I was talking about her rages. And so that opened actually the door for us to have more conversation about, how much can I talk about, our life, and one of the things that we did like was the way that they portrayed her to be very healthy and very happy, and that, not everybody who has a mental illness looks crazy, or, they're not always in a bad spot. So that was helpful.
I am going to ask people to raise their hands really quickly. I hope you participate in this. But the reason I'm going to do this is because the reality, and the question I'm coming back to is a 17-year-old nearing 18 who potentially there's some concern regarding substance abuse or underlying mental illness, and kind of what do we do? And the question I would ask, and I ask families this all the time because the legal system comes up 90% of the people I work with. How many families in here right now would call the police on their loved one and actually press charges and watch them go away in handcuffs? Can everyone look around and see the number of hands that are up? Not very many, right? And so again, when somebody is in the legal system, of course, the first thing you want to do is look for an advocate, somebody like me who understands how to navigate through it, but also in terms of looking for an attorney. If anyone is in the legal system, take down this website. It's AVOO. It's a peer-based legal representation website. So it's rated from not only your peers who are attorneys, but also by your clients. So you have a wonderfully based system to go through and pick out an attorney anywhere in this country who's not only been reviewed by his peers, but also by his clients. And what you would want to look for are alternative sentencing specialists, right? DUI attorneys don't know what they're doing, okay? Alternative sentencing attorneys know exactly what to do. They know exactly what to say to the judge. They have relationships with these judges, and they know exactly how to navigate between this is a true mental illness, this is an addiction, and they know how to really present this to a judge. Because the problem you run into with attorneys is really no different than any other profession, is that how much education did this attorney get in addiction or mental illness going through law school? Zero. You look at physicians, how much education did they get going through med school with addiction? Zero. So a lot of times what's happening is we're going to these people who we expect to know because they're respected in the community, they're well known in the community, they have just as little knowledge as we do when it comes to this. And so my recommendation is for the family who's out there who's dealing with this, soon to be 18-year-old, there are a massive variety of options to do with a young person like that. Whether it's trying to engage with somebody in a therapeutic alliance, a relationship with somebody. There are a lot of different options for treatment, assessment, but figuring out somebody who can really come in and guide you, whether it's a local therapist that you know, whether it's a consultant that you know, with somebody who's going to be able to walk you step by step through that process. Because the reason I wanted to ask this again is because getting somebody in the legal system is a great place to have them, because then we have a little bit of control, we have a little bit of power over what they do and what they do not do. But you have to have somebody who knows how to navigate that. So you might tell an attorney, we've got a 28-day treatment, but your loved one might need 6 months. So is that really an effective strategy as well? So there are definitely people who can walk you through the questions, especially what happens when they turn 18. That's a whole nother set of circumstances as well. So definitely reaching out to somebody who knows how to navigate through all the variety of the legal system, as well as just the treatment, how to figure out what the problem is and then address the problem accordingly as well.
We've got time for just a couple more questions. I wanted to point out that we're blessed in Fairfax County that a number of our law enforcement officers are actually trained in how to deal with those with mental illness, with behavioral illness, with those charged scenarios where someone is just being unsafe, either to themselves or someone else. So if you do call, make sure you mention what the particular circumstances are so that you get someone who's trained there to help you. Most of the time, it is about making sure that...
You want to ask for a CIT trained officer.
Thank you. A CIT trained officer to make sure that they know what they're dealing with and to deal with it safely. We are really blessed in this county now.
Crisis intervention trained officer.
Christy, really quick, you talked about CSA, and I wanted to come back to that for just a moment because we had a question about it. Can you explain what it is again, and how does a parent advocate for CSA services for their child?
Sure. So the CSA program is the Comprehensive Services Act program, and we have the director here, Jim Gillespie, raising his hand, who's moving on to another position soon. But basically, there's a couple different entries into the CSA program. If your child's involved in the Department of Family Services, the juvenile justice system, or has an IEP, which means that they are receiving special education services in the school system. That's an entry into it. If your child is not in any of those systems, and that was sort of our case, the social worker in your school system would be the person to reach out to. And a lot of people don't think that there's a social worker at your school here in Fairfax County, but there are. Each school has at least one social worker assigned. I'm not quite sure I know exactly how the high schools work. At my daughter's school, there's a social worker and a psychologist, as well as the counselor. So I'm not talking about the counselors, I'm talking about the social worker. And you need to ask for an appointment, and then you need to tell them that you want a family resource meeting, which is an FRM, that you really need to play up how bad the situation is. You're in crisis, don't hide anything, this is the person you want to be the most honest with. And tell them all of your concerns. Just another thing to note for families here, because all of you are mostly, I'm guessing, parents of high school kids. In Virginia, the age of consent for treatment is actually 14 and up, not 18. And so I've been working to try and get that changed in Virginia. There are a lot of people that are resistant to that for lots of really good reasons. So there's legislation right now that's being considered this week that would actually just sort of change the way that kids are seen between age 14 and 18 and make it very similar to the way that kids under 14, the categories for inpatient care. as well as if a child is already being in an inpatient or residential treatment center and then they start to refuse care at age 14 and up, the parents would be required to be contacted.
We had a question, since you bring up advocacy, and I know it's been a theme throughout, we actually are blessed to have a school board member here tonight who asks, they have done a lot about physical and emotional health and well-being. And with this epidemic that we've had in Fairfax, there has been a lot of resources put into certain schools in particular, but across the county. But there's an ongoing question about what specifically can we do to be more effective in addressing mental health and substance abuse.
I'm going home now. I do know that for things like depression awareness screening, that's a great place to start, but I think that when you find the positives on the screen, you have to have a plan in place for what to do with them. Because it sounds like the one teenager who was here earlier, the young man who kept lying every time he got to a treatment opportunity, as soon as he was selected for coming in across the cutoff, they didn't know what to do. They just told him he was depressed and they told his parents to go get him some help. That's not advanced planning. So I think if you're really going to do this and actually screen for people, there need to be referrals in place in the community, whether that's in the primary care office with psychologists embedded with them or some child psychiatrists that you have that you can refer to, but you have to have a crisis plan, because if you're going to look for the problem, you're going to lift that corner up, you're going to find it, and then you're not going to know what to do with it. And so when we have screening for suicidal ideation and other medical illnesses in the hospital, they have a plan of who they're going to call, in our hospital at least, so that people can get evaluated quickly if they come back with a positive suicide screening. So I think the schools need to do something.
I would say, since it's a school board member, that, just remember when you're working on the budget and everything, how important the social workers are, especially in the way that we have the system set up in Fairfax County. Now that could change in the future if we are able to build up the Community Services Board, which we actually haven't even talked about, which is the CSB, which provides the behavioral, mental health, and substance abuse care here in Fairfax. But it's really important that we understand that when it comes to cutting the budget, if that needs to happen at the school level, that we do not cut social workers, counselors, and psychologists. Those are extremely important positions.
Absolutely, and it's very interesting coming from Langley High School, because I have an approximate number of kids that graduated from that school. When I went there, it was around 2,500 in the school itself, and recently in the last 2 years I've become acquainted with the 2 school psychologists. So if 10% of the people at Langley High School have some type of issue that they need to go to somebody with, that means these caseloads of these psychologists are 125 students each. That's unbearable. Nobody can handle that type of caseload. But we're talking about getting to high school at that point. I mean, realistically, the most effective measures that we've seen when it comes to substance use in general is prevention and early intervention. So we're talking long before somebody's getting to the high school age. So, interesting, coming up in the 80s, we very much a Scared Straight campaign and everything else about, this is what's going to happen to you if you do drugs, and we're going to try and scare the use out of you, for the most part. And again, I think coming from a very objective educational standpoint at a very young age, improving communication within families. I've recently heard of a great new movement called Drugs Over Dinner, which is really cool, and I think that's the website, drugsoverdinner.com, and their whole movement is basically like, we need to begin having the conversation over dinner. This needs to become a topic of conversation. We can't rely on just the schools. We can't rely just on the parents. We can't rely just on the school counselors. Everyone has to step up to the plate here and begin to have these conversations. And it doesn't just have to do with addiction, but it also has to do just in general with stigma around mental illness. So I think, again, what do we do? It's like we need to revamp our early prevention and education strategies. We have to be intervening on kids where we're noticing behavioral shifts in 6th, 7th, 8th grade very early on, and addressing the underlying core issues that are driving people to these uses. So when we look at strategy-wise, I don't think we're there yet. I think we're improving. I think we're moving in the right direction. But I think, again, we're still so far behind where we could and should be when it comes to treating our local communities.
Yeah, I would agree with that too. I mean, it's a very complex systemic problem, and we're not going to be able to find pat answers. But that idea of early prevention, I mean, age 12 is where all of a sudden there's this cliff, that the mental health problems start to show. But there's always undercurrents, and so the earlier, the more often, the more we talk about it, the more we reduce the stigma, the more we examine our own attitudes, the more we think about what we really want, for our children, and communicate that to them. I talk to parents about, what's your 30-year-old like? Because we get very caught up in this sort of academic, competitive environment, and the truth is that the rest of their lives, quickly all of that's in the rearview mirror, and it doesn't matter. So I think there's so many different aspects of this that we need to tackle all at the same time.
Before we stop, Lauren, you had an announcement to make.
Oh yeah, here's a new resource website for this area that kind of can connect you to a number of resources that volunteers are doing for each other. So, bring everyone's attention to that. We have to.
Okay.
Can
Thank
you
you all
read
for
it
your
out?
questions. We didn't get to all of them. I apologize, but please join me in thanking our wonderful panel. Thank you.
Thanks, Bob. Thanks for our panelists. And thank you all again for coming out this evening. I don't think I introduced myself in the beginning. I'm Lauren Anderson, the Executive Director of the Josh Anderson Foundation. Thank you for coming out to this event. This event was really put together in part by many members of the Community of Solutions group that's been working really hard in the Woodson, school and the Fairfax area. So thank you again for being a part of this movement. I hope it was educational for you. And please continue to support our efforts, the Josh Anderson Foundation. We have our biggest fundraiser coming up mid-March. You can go to our website and check that out if you want to support our efforts. Thank you so much for being here. We have many exhibitors in the outside area, so feel free to continue to pick up information and resources. Thanks.